Over 60? If you've been told that castor oil and rosemary are just old-fashioned home remedies, you might be missing a powerful natural alternative that can impact your joints, circulation, even your memory. But here's the shocking part. Use them the wrong way, and they can irritate your skin or even interfere with your medications. Harvard research shows why certain plant compounds can mimic medical effects, both good and bad. Stay with me, because at the end, I'll give you a safe 7-day checklist every senior should follow.
Many seniors hear about castor oil and rosemary through friends, family, or the internet, and believe these remedies can replace proper medical care. The problem is not the oils themselves, but how they're used. Studies show nearly 37% of seniors rely on unproven natural remedies without guidance, and this often delays treatment for arthritis, circulation issues, or even early memory loss. The consequence? Joint stiffness worsens, blood pressure remains uncontrolled, and in some cases, ignoring circulation problems increases the risk of heart disease or mini-strokes. And let's be clear, using these oils incorrectly, wrong ratios, poor application, or mixing with medications can cause skin irritation or interfere with blood-thinning drugs. Without the right knowledge, what should be a helpful natural support can become a hidden danger after 60.
So, why do castor oil and rosemary seem so powerful, yet sometimes risky? The science comes down to two key compounds. Castor oil is rich in recalic acid, a fatty acid with strong anti-inflammatory properties. When applied to the skin, it penetrates deep into tissues, reducing swelling and stimulating lymphatic drainage. Think of it like a gentle pump that helps move stagnant fluid out of your joints and muscles. That's why some people notice relief in stiffness or swelling within days. Rosemary, on the other hand, contains rosmarinic acid and terpenes that improve circulation and boost nitric oxide levels in blood vessel walls. Nitric oxide acts like your body's traffic controller. It tells blood vessels when to relax so more oxygen and nutrients can flow through. Clinical studies show that rosemary aroma can even improve memory and alertness in older adults. But here's the catch. Natural compounds are not always gentle. Too much castor oil can irritate the skin. Rosemary oil, if undiluted, may raise blood pressure in sensitive individuals or interact with anticoagulant medications. The takeaway: these remedies work because they mimic certain medical mechanisms: anti-inflammatory, vasodilation, cognitive stimulation. But they require careful dosage and context. Used wisely, they can complement senior health. Used blindly, they can create new problems.
Let's go through the 3 most common mistakes seniors make when using castor oil and rosemary. Mistake number 3 is using the wrong ratio. Many people simply pour castor oil directly onto their knees or hips, hoping for instant relief. The science shows that retinoic acid, when undiluted, can irritate the skin. The safe ratio is 3 parts castor oil to 1 part total drops of rosemary. I remember a 68-year-old gardener who applied pure castor oil every day and ended up with rashes instead of healing. The solution is simple. Dilute properly, massage for 5 minutes, then cover with a warm cloth. Doctor's note: if you have rheumatoid arthritis or open skin, check with your doctor before applying any oil. Mistake number 2 is ignoring circulation technique. Cold hands, swollen ankles, and night cramps are circulation problems, but just rubbing oil randomly doesn't work. Blood flow only improves when you massage from the toes upward following the natural lymphatic pathway. A 72-year-old man from Florida reversed his nightly foot cramps within 2 weeks simply by changing his massage direction. The solution? Start at your extremities, work slowly toward the heart, about 10 minutes each session. Doctor's note, if you're on blood thinners or have varicose veins, always consult your physician first. Mistake number 1 is believing oils are a cure, not a support. Castor oil and rosemary can reduce inflammation, improve blood flow, and even sharpen memory, but they do not replace medication for hypertension, diabetes, or dementia. One of my patients, a 65-year-old woman, stopped her statin and relied only on these oils. Within months, her cholesterol spiked again. The safe path is to use them as a complement, not a substitute. Doctor's note, always inform your healthcare provider about any natural remedy you add, especially after 60 when multiple prescriptions are common.
Now, let's turn this knowledge into a simple 7-day plan you can actually follow. Day 1 to 2, focus on joints. Dilute 3 tablespoons of castor oil with 10 to 15 drops of rosemary oil. Massage painful knees, hips, or shoulders for 5 minutes, then cover with a warm cloth for 30 minutes. Do this twice daily. Day 3 to 4, support circulation. Apply the same mixture starting at your toes, massaging upward to calves and thighs. Spend about 10 minutes, once in the morning and once before bed. This helps reduce swelling and promotes warmer hands and feet. Day 5, calm your nervous system. Before bed, massage a small amount onto the soles of your feet and temples. The combination relaxes your nervous system and can improve sleep quality. Day 6, memory boost. Inhale rosemary aroma directly for 30 seconds, 3 times a day, while applying diluted oil to the temples. Seniors in clinical studies showed measurable improvements in memory recall within weeks. Day 7, review and adjust. Notice how your body responds. Less swelling, better sleep, improved energy. If you feel irritation or take prescription blood thinners, pause and consult your physician. Doctor's note, these steps are supportive only. They do not replace prescribed treatment. Always check with your healthcare provider if you have chronic conditions or take daily medications.
So here's the truth. Castor oil and rosemary are not miracle cures. They are natural supports that can ease joint pain, improve circulation, and sharpen memory when used correctly. But the real danger comes when seniors treat them as replacements for proper medical care. After 60, your body deserves both the wisdom of natural remedies and the safety of professional medicine. Not every natural remedy is safe, but the right habit at the right dose can protect your health and independence. Which of today's points surprised you the most? Leave your thoughts in the comments. I read them all. And don't forget to subscribe for more senior health tips straight from me, Dr. Thomas. In the next video, I'll show you how a single morning habit can lower blood pressure after 60. Stay safe, and I'll see you then.